in the chat area is this one right here.
Okay, and if I can have one by one, each person introduce themselves. Again, I'm Joni Saunders. I am going to be working with you all on Workshop Wizard, and I'm with the Consortium for Older Adult Wellness.
I'm LaDonna Gamble, and I'm in Roswell, New Mexico, working with the Prediabetes Program.
Wonderful.
I'm Leslie Thompson. I'm with San Juan Regional Medical Center in Farmington, New Mexico.
I'm Christine Calvin. I'm with the UNMH Center for Diabetes and Nutrition Education in Albuquerque.
Great, welcome. That might be everybody. If you could do me a favor and go ahead and just also type your name down in the chat.
My name is,
okay. And that'll help us get a nice roster. And Sue, are you able to talk? You may have to unmute your phone.
Can you hear me now?
Yes. Is that Sue?
Yeah.
Wonderful. I'm going to try to mute. I'll go ahead and let you begin. I know you all wanted to spend a little bit of time talking about the new information about NDPP being covered by Medicare, Medicaid. And so I'm going to turn that over to you, Fritz, for a few minutes.
Sure. Hopefully this isn't coming out with an echo for all of you. Is it echoing to you, Joni? Joni, is it echoing?
Just a little bit for me. Are you using your computer? Are you using your computer audio?
I don't have a. Oh, I have the computer audio on, and I'm on the phone because I don't have a mic.
Okay, then you want to probably just click on the phone call. So at the top you should see audio, and it's, if I understand you have computer audio turned on. You want to click that off so that phone call is the only thing turned on.
Okay, whoops. No. It's red. Is that off? Yeah, it's
No.
off. No.
Okay.
Well, is there another way of turning off the phone?
Yeah, if you're going to call, you called in from your phone, is that correct?
Yeah.
Okay, you may want to go out and come back in and make sure just your phone radio button is all that's turned on. It should have a black dot in the middle.
Okay.
We're going to wait just a little bit to see about getting Sue back on here. Sorry about the technical difficulties. Yeah, you want to have just one of those audios turned on.
Mm-hmm. Okay, let's see. Okay, so the audio is green now.
Okay. And just the phone call should be turned on.
Okay, so what I want to do is join the audio conference?
That's correct.
Oh, I see. Okay. Okay, how's that?
That should be good.
Oh, no echo. That's perfect.
Yeah, it was just picking up your computer and your phone were picking up you guys talking.
Yeah, sorry.
Oh, no, you're good. You're good.
All right.
And so what I just said to is I was just going to turn it over to you for just a few minutes.
Well, this is actually very quick. What all of you that are at least in the NDPP process should have received a email from DPRP announcing that last week it was signed or agreed that Medicare would pay for Medicare participants to participate in certain evidence-based programs, and one of them was the NDPP. There wasn't anything there in terms of how to make that happen yet, and since we all know that there's actually a very small number of actual recognized programs versus all of us that are participating in the NDPP, somewhere along that spectrum, my concern is that, I don't know if my concern, we need to find out whether or not it's the kind of thing where you can only start participating in Medicare payments if you become recognized. And then if you're not recognized, that will open up some other questions. So that's all I know about it in terms of reading that. What I would like is if any of you have not received that email from DPRP, if you'll send me an email, I will forward it to all of you so you can read it from the complete email about that. And I've also forwarded it to Judith and to Chris to see if they can't find out, a little more specifics about that. And that's really, if there's anyone that knows any more, we would love to hear from you.
Okay, and please remember to unmute your phone if you do want to talk or add in the chat section. Okay, I'll take our silence as that we're ready to move on. Thanks, Sue. I appreciate that. And it is really good news. Of course, we still have a lot of things that we need to have answered as far as participation, but the fact that we're even moving that way shows that we're definitely getting to move forward, so that's really good. Mm-hmm. At any point, if you have a question or you need me to slow down, again, this is being recorded, and this is for the current DPP lifestyle coaches. What I'm going to go through are ways that we're going to enter in information for Workshop Wizard, and this is going to be how you can collect and keep all your data and keep your workshops, your classes actually organized. So as you should see right now, a blue page that says Workshop Wizard, and I'm actually using the demo wizard. We do have the New Mexico, quite a bit of information entered in there. However, a lot of that information is HIPAA compliant, and I will be playing around with this a little bit. And so we want to make sure that we keep your information as clean as possible, your data as clean as possible. So you will be receiving your own unique user ID and password. So for the purposes of this, I'm going to go ahead and put my information in. And again, you'll have that unique ID and login specifically so you'll have access to different levels of functionality. So depending on your organization and depending on your role within that organization and what you're doing with DPP, then that's the type of access you'll see in Workshop Wizard. What I've done is limited my access so that you can see the majority of what you'll be seeing. There might be one thing I set back up here in just a second, but I'll talk through that when we get there. Okay, now you should be seeing a page that has several people sitting in a classroom, and then on the left-hand side, my workshops, people, information about referring entities, individuals, participants, and import and export. I'm going to come back to my workshop, but I'm going to start here with actually doing a little bit of access for myself, if I can. Okay, so let's actually start under people, and some of you may have this ability. Again, some of you may not, depending on your organization. But people is where we add all of our contacts, our organizational contacts, possibly our site contacts. So for example, Kaiser Permanente is one organization. However, there might be Kaiser East and Kaiser West as two different sites where we're holding classes. So your site contacts are also going to go in here. And there's two things to really remember about Workshop Wizard. One, it's only as robust and as useful as the amount of information you're putting in, and you always have to tell it what you want. And so when we are adding people, one thing I'd like to show over here, these are all people types. And these are going to be ways that we're actually able to identify specific people and how we interact with them. So I'm going to start by showing you under General. This is where we actually enter in people to the program. Again, I'm going to tell Workshop Wizard that I would like to add a person. I know that it's ready to add a person by the gray new person here. And again, people is not what we're using to enroll participants into our program. Again, this is going to be used as our contacts, site contacts, our leaders, people who may be handling referrals. So I'm going to go in And I'm going to add someone just so I know how I'm able to clean this up later. And so I've now added Smith to AAA. And of course, we would enter all this additional information. I'm going to go ahead and make Smith a referral handler, meaning that they'll be able to talk to potential participants and get them enrolled into classes. I'm going to make them a site contact, an organizational contact, make them a leader, and go ahead and make them a workshop contact. And I'm going to save those changes. If I go back up now, as you can see, the new person has changed to Smith, meaning that it has been loaded into the program. If I was to go under classes, I would be able to add information about Smith and the different types of classes that possibly that person, let's call it he, has taken or has taught. And when I say taken, I mean as a leader. So different types of leader training. See if we have some in here. And to do this, all I would do is pick out the type of leader training for the class that has possibly been taught or a class that has gone through Fidelity. For DPP, that is not as much needed as the chronic disease self-management. However, New Mexico may choose to go in and do Fidelities on their leaders. But again, that is not something that has been required by the CDC. I just pick out that class. And now I show that Smith has actually taught the chronic disease self-management class. I'm going to go back also to certificates. And if we have just now trained Smith to be a new leader, I would tell the program that I would like to add a new leader. And I'm going to actually go in and I'm going to make this active. I would put in the different curriculums that that person is. We're going to go ahead and say new. And we're going to tell the system when this is going to actually expire. This is so we can keep track of any of the people who might need a Fidelity or need to be retrained. Save changes. And as you can see, now we have new up here as the new curriculum. So I'm going to go again. A new one. And I save my changes. And now I have the other curriculum that Smith has been actually enrolled in. Now I'm going to go back, and all I'm going to do right now is just search everyone so you can see the amount of people that we have in the system. So a lot of people, right? But let's say we want to find people who are only our site contacts. So now this is going to pull up just those people who are site contacts. And go back here and research. Let's say I wanted to find all the people who are actually able to enroll or handle any type of referral. Then I would just go to a referral handler. I would search, and that's going to pick up everyone who can handle referrals. Now there's several ways. Again, we can activate as many of these people types as we would like. In addition, we can search by organization. We can search by people who are going to who have taught curriculums. We can search actually by a county that someone is located in. And we can also show different certifications that people have had and when those certifications will expire. So before I move on, I'm going to ask if anybody currently has any questions with our People tab and how it is being used.
I don't have a mic in my computer, so it's
How this applies to NDPP is that if you have different sites that you're working with, you're able to keep all of your information in one place as far as your contact information. You're able to keep contact information for the organization that you're working with, anyone who may be also trained under your organization as a lifestyle coach. Basically, it's a way to keep any of your contacts organized. Did that answer your question okay? And I think I have someone who's not muted right now, if you don't mind muting your phone. And Christine, please let me know if that doesn't answer your question. Also, in addition to this, when we are setting up workshops or you have a workshop set up, which currently you're not seeing over here, and I'm not exactly sure if you all will be setting up your own workshops, a person as a workshop contact can be added into that workshop and also as a regular site contact for people to be able to get in touch. And again, I have someone who's not on mute, if you don't mind muting your phone for me. I'm going to go ahead and just mute everybody. Okay. So again, if anyone has any questions, please just put the question in the chat field for me. So as we're moving on, one of the big things that we want to, especially as a lifestyle coach, we're going to more than likely be handling referrals and enrollment. Again, this may be limited depending on your organization. However, we're going to be wanting to track that information. So this is actually going to be our enrollment area. And a referring entity, this is going to be our overall umbrella of an organization. Again, like I was saying, we might have Kaiser East referring, and under Kaiser East we have Dr. A, Dr. B, and Dr. C, each referring. So just to kind of go through it, I'm going to go ahead and add an entity. Again, I told it exactly what I wanted to do. Pick a health system for that, and pick anything here. I'm going to stick with Kaiser, and then again, I'm going to save my changes. Hopefully here you've seen that Dr. Scott has now been entered. Now I want to be able to connect a doctor or another individual. Let me go ahead and stop there. This can be any entity. So this could be, I saw them at the health fair. This could be marketing at the local rec center. This could be New Mexico newspaper. So this referring entity can pretty much be anything that you would like to track. Now if I go to referring individuals, I'll want to connect somebody with Dr. Scott and Dr. Scott MD. So again, I'm going to add an individual, and you can see now I'm ready. It's gray here, and it's ready to tell me a new referring individual. So I'm adding Dr. Pam, but I want to again link that person, and we're going to link it to Dr. Scott MD. And of course, we want to have that person's contact information. Again, this would be someone that we're receiving an individual's referral from. I'm going to save my changes. And as you can see, Dr. Pam is now populated into the system. Now, as far as enrollments go, this is where, although it says referrals, I consider this the enrollment area. This is where we're putting participants into classes. And so I'm going to come back to our search function in just a second. I'm going to go to General, and under General, this is where I'm going to actually be able to go in and enroll someone into actually a workshop, sorry. So an NDPP class. Again, I'm going to tell it I would like to add a referral. So this could even just be someone that is having an inquiry about the class, or we're actually going to enroll them in the class. So we either received a phone call, a referral, a HIPAA-compliant email, secure email about Tim. And we want to be able to track Tim's information. Let's say we received a fax referral from Dr. Pam. Again, we're going to want to enter in as much information about Tim here. As much info here as we can. You want to put in here, if it is indicated on the referral, if it's okay to leave a message. From HIPAA compliance, usually they're going to state whether or not it's okay. Preferred language, we have Spanish classes in addition to our English-speaking classes. And so we'd want to indicate if our Spanish program coordinator needs to be the one to call. I'm going to put it in our referral date. So we're going to say that Tim called today, or we received Tim's referral today. And we're going to indicate what kind of program Tim is interested in. And then let's put in Tim's birth. So at this point, if this is all the information we have about Tim, and we have not enrolled Tim into a class, this is just an inquiry, I'm going to save my changes. Here, I'm going to actually go in and say that maybe Tim wants to check with his wife. Again, I'm going to save my changes. Now, if I have called Tim, the best way to do this is I'm going to put in here past contact. At COA, we try to contact people about 3 times. Now, that's saying if we're leaving a message. However, if someone has indicated that we have a class that maybe doesn't fit their schedule and they would like to be scheduled for a different class, then we're able to keep all that information in past contact. So again, I'm going to tell the system I'd like to add a contact. And do you remember whenever we went in and Smith, our new person that we added under people, we said that that was a handler. And as you can see, Smith now shows up as our handler. Again, the person that is handling this referral. So this is where I'm going to keep any type of information that may pertain to the different contacts that I'm having with Tim. The reason we like to do this, one, is hopefully you're getting so many referrals you can't remember how many times you contacted one person or the other. Also, there may be different program coordinators that are working with referrals, and there could be a number of people who may be enrolling into a class. So, for example, if we are working with the rec center and I, at COA, can enroll people into a class, I might have a contact at the rec center, so if the rec center was called, who can also enroll someone into a class. So I'm going to go ahead and save my changes. Now I'm going to go back to the search function, and here, as you can see, we have a lot of people enrolled in our classes, or at least that have had referrals. So if I wanted to go in and just see people who have been enrolled into classes, I would search, and it's going to show us the different people for different classes. I can go in and search by name. We have a few Tims. I could go in and even search by referring entity. Let's go to Dr. Scott. We put in his information. And again, here's our 10. So there's going to be multiple ways that we can actually search for different people who have been enrolled, or, again, we need to call back. And just 1 second, I'm going to show you why having that referring entity information becomes very important. So let's go back to Tim and go back to his general information. And once we have classes set up, and again, I'm not sure the level of access if each one of you will be setting up your own classes or if that will be your administrator. At COA, for example, we are able to set up classes for our different organizations. whereas our organization does not necessarily have to go in and set up that workshop. This is very useful for us to be able to keep control in this organization, to see which classes are going, and to kind of be looking for what type of information and data we'll be collecting. So we're going to pull down here, and these are all the different classes that we currently have set up in the system. And we're going to go ahead and put Tim into 4 Points Center DPP, and we're going to save. Now, if I were to go back here, I'm going to search, and I want to find everyone who has been enrolled into that class. People enrolled, and Tim should come up. So now we have Tim Parsons as our person who's come up. Go back here, and if I decided that I want to look at anyone that is coming from a specific referring entity, and let's go and see if there's anyone who's been referred from Dr. Joni's hospital system. So we have Sam Saunders. Now, I would like to let Dr. Nicole Miller at Joni's hospital system know what has happened with Sam Saunders. We don't want that referral just to fall into a black hole. And I know here at COA, and hopefully something that will be established as the best practice with New Mexico, is we like to send referral logs. This definitely helps establish our relationship with any type of providers we're working with. If we do have possibly a rec center that seems to be generating quite a few referrals, this is a good way to get that information quickly. So what we would do with this, we would go reprint, and it's going to show us our different information. And then I'd say go, and ideally this will pull up information about Sam Saunders. If you see over here, this tells you information about when we've called, when we wanted to contact again, if they've been enrolled into a class, address information, and the entity that has actually referred. I'm going to close this out. I'm going to go back to search just so we can look at it with a lot of people. Search. And this is all in real time. This also really helps to be able to print rosters and to be able to see basically get a good idea of different entities, and again, enrollments. You can pull these up by all the different search functions under the referrals. You see, because I searched everybody. And again, all of our note information is listed over here. And it's just a really good way to close that feedback loop and to share information with the organizations or contacts that you're actually working with. So I'm going to move back over here to our workshop wizard, go to our search function, and see at this point if there are any questions about the referral/enrollment area. All right, wonderful. All right, for NDPP, this is where it gets exciting. We're going to go, whenever a person has been listed as the lifestyle coach for a program, and again, depending on your level of access, whether or not you have the ability to add that person or it would be your main administrator, then it's going to show up under their My Workshops. So currently I'm being shown as the lifestyle coach for the diabetes prevention program with Dr. C program at her site. I'm going to pull this up because I want to manage my DPP workshops. This is the one I want to manage. I'm going to tell it next. This is where I'm going to enter all of my weight and activity info for the participants in my program. I go here to enter weight. We can add our new session. And let's say we're going to have a new session on the 23rd. It is a, oh, that's passed a bit. Let's make it on April 6th. It's a core session versus a makeup for core or post-core session. Keep it as core. Then we're going to say next. And we're going to go ahead and save changes. So I'm going to come back here to my workshops. Manage it. And now you see that the April 6th is located in here. So I'm going to click over here. Actually, we may not have anyone enrolled quite yet. but we can do that. All right, so you will only have to enter this information once. And so you'll actually go in, and we're going to add a participant to our program. All right, let me go back here. All right, now as you can see, Sam Tim, who has 2 first names, basically has now been entered into our system. We went back to September 1st. This should show his weight and his activity. The reason why it's blank, obviously, on this one here is because that would be a different session where we would actually put in Sam Tim's information. So again, you only have to enter in the person's name once. Now I've saved my changes. All right, go back up here. And then we're going to show our new one here. And so as you can see now, we have all that information entered in. So I forgot what each person weighed, but hopefully let's make sure that they're losing weight and upping their activity. I'm going to save my changes. Okay, I'm going to go back out here, and the reason why I keep going to people is I just want to make sure it's populating on my end. And so now if I decided that I would like to see this progress and see how everybody is doing, or print their how am I doing chart, I can go up to print or email charts. I'm going to go ahead and do it for all my participants, which is a whopping 3 at this point. And then I'm going to download that, and that's going to give me a spreadsheet or a PDF now showing the weight loss of Joni Smith. My activity has gone up a little. Look at Lynn Rogers is through the roof, just really rocking it. And obviously the activity level has gone up. And then here's Sam Tim, and we can see how the weight loss is happening here, and the activity has really gone up. Again, this is either a good way for you to quickly be able to get a visual of how people are doing. In addition to, you can share this information with participants. If you do collect or have permission to email, this does become email compatible. And close out of that. So my workshops, obviously, that becomes very important for us as we're working with the CDC and working on recognition. If you've decided not to work towards recognition and you might be a site or an organization just doing DPP, this will still allow you to keep track and collect that data that could be useful for funders, additional programming. It just makes for a really quick, easy way to record all the data that you're needing. So at this point, I'm going to stop again, see if anybody might have any questions. Okay, our chat doesn't seem to be blowing up, so I'm going to take that as a good sign. But again, please let me know if there's anything you need to go back over, or if you do need me to possibly review something. I'm going to go down now to our participants tab, because if you can remember, or I'm sure you know, when we're collecting information for recognition, we have to have a lot more information other than just their weight and activity. We're going to need to know race and ethnicity. We're going to need to know height, how their prediabetes diagnosis has been. And so under our participants tab, we're actually able to put in that information. So I'm going to go down again, and I'm going to tell Workshop Wizard exactly what I want to do, and I want to add a participant. And some of this functionality you will be seeing change. We are working currently, we're on the last part of the functionality for being able to export your CSV file directly to the CDC. So it'll get to, once this is entered in, you'll basically press a button and it's going to be going directly to them for recognition. So again, some of this that you're seeing right now has been set up for HLC, not HLC, y'all don't do Healthy or Living Colorado. It's been set up for the chronic disease self-management and partially for NDPP and DPP. Go back up, and I'm going to give it just a general batch number here, and I'm going to be entering in information for our participant. I'm going to go ahead and enter in information for 4 Point Center, and here, this information is going to become de-identified after it has been entered in. So as you know, we have the participant code. The only way that we're going to be able to connect this information is once it's entered into my workshop, and then it is de-identified when sent to CDC. So again, we have our curriculum. We have our workshop. You might want to go down. /or is the one that is referring for this workshop. You may want to put in specific counties. And again, for the New Mexico one, and I can actually show that to you in just a sec, this information is already populated with New Mexico County, their date of birth, of course, all our information here. We'll want to indicate all the information that has been collected from our, been collected as data for our CDC recognition. We may have additional chronic conditions other than just prediabetes. This could be useful in our running reports. However, this will not be something indicated on the CSV file. Some additional information here. This is where we would add our height information and how a person has been given their CDC prediabetes diagnosis. Then we would save our changes. Now once the functionality is ready, we are going to be able to export this data that we collected for our participants and also their weight and exercise all into one CSV file, and it will go directly to the CDC. Now I'm going to get on to the New Mexico site here. And as you can see, there's a ton of functionality that we can have. And so the main things that you might be seeing, again, my workshop completely goes with NDPP. Find is more than likely not something that's going to be used. Again, you see the people, and here we've added people type and how that person's met, the different organizations and sites we're working with. The big thing that I wanted to point out is if you are going to be responsible for actually setting up your workshops, so that doesn't need to go through an administrator, you'll be able to go to workshops and training, go to general. Again, I'm going to tell it to add a workshop. Always got to tell it what to do and then save it. Now I have new workshop, and I'm going to go through and I'm going to actually add different information for a workshop. And all I have to do is go through and identify all the information that might be needed here. Again, before we had identified our different contacts for our health systems, and this is your real data here. That's why I'm not going to save, because I want to keep this clean. I heard a really great statement this past week at the ASA conference. We want to keep it sushi grade data. So I'm not going to save this one, but this is how we would basically set up our workshop. Our contact is going to give us all the contact information. Kelly Jackson's also part of the COA team. Of course, everyone knows Sue. Any type of health system, and then our internal and website comment. Our website comments are things we would like to share with the public. So that could be there's going to be a $10 charge, parking's in the back, make sure you're there by 4:30. The internal comments, this is going to be stuff that is just specific to your organization, not necessarily things that we want to put on our website comments. And then, of course, which I'm not going to do, but we would save changes, and then that class would be available for when we are going to enroll people. Here are all the classes from 2015 to 2016 that have been set up in the New Mexico system so far. Of course, those continue to grow. We can put in as many curriculums as we would like. So, for example, we have all these evidence-based curriculums, but possibly one organization wants to do healthy cooking with Joni. Then we can also put that curriculum in there and build our workshops. So this is kind of unlimited as to what we want to put in here, but again, that will be limited based on our access. And then reports, this is going to be where we run reports about specific organizations, any type of information about specific lifestyle coaches. We can actually compare sites. So again, if we want to compare Kaiser East to Kaiser West, we'll have the ability to do that all here. Again, I'm not sure if any information has been entered into this, into the New Mexico, but we're going to go ahead and try. I'm going to search all of it. And I just searched a whole lot of stuff. So hopefully I'm not breaking the system here. I probably should have limited it a bit. It might be good. So again, this was a huge search. I did all organizations, all workshops. So up here, though, once you are able to have access for your organization, you can specify exactly what you want to search. But here we're showing that with the New Mexico Department of Health, we've had 228 workshops. This shows our completer rate, way to go. The number of people who were support persons. But then it also gets into information about our ethnicity, gender, age values, any type of additional chronic conditions, counties. This is also all in Word format. What makes this nice is that you'll be able to manipulate the document as you need. So there, you might want to add footnotes or graphs. It could be, again, if we're searching a specific class, it might be that the completer rate was low because we had 3 snowstorms in the middle of class. But again, I don't want to give you too much crazy information because your access may be limited at this point to just a few different areas of functionality. All right. So when I open this back up, I'm going to leave this question, Christine, actually open to Sue. I'm not sure, of course, if you want organization and the ability to be very transparent and to share information and a really quick way of getting that information to the CDC, then I know that that is something that the Department of Health is wanting to move toward. Again, this is your first glimpse, probably, of seeing this. All of our trainings will be recorded. In addition to that, you will be receiving a user's guide and have access to me as far as any type of functionality questions you might have. But I'm going to go ahead and let Sue, I'm going to unmute you here and see if you would like to answer the question about if all organizations were going to have to use the system. And after we answer that question, Leslie, I'll go to you.
Okay, so no, you don't have to use the system, but I guess the question in my mind is someone that does the program as well, why wouldn't you want to? Because it will make it so much easier for you to reporting and actually be able to go in during the year and see what percentage of my people have lost 5% and be able to figure out your status and such, and it will all be formatted so when it's time to report to CDC, all your data is in there, it's all organized, all you have to do is essentially hit a button, download it, and send it off instead of going to go through and set it all up yourself. So the idea is it will really assist people with being able to do recognition as something that we want to participate in, but that it really is almost like a second thought from the real value of being able to do referrals, see what's going on with your people, follow up on people, see how your groups are doing during the year and not 15 months later when you get a report back from CDC regarding your status. So that's what that is. So
Thank you.
Yeah, just to, I'm looking at your question about it seems like an add additional layer of work. Well, I don't know. I guess it depends. If you've got someone that just does that for you and they love doing charts and stuff, maybe, but they could be doing this, and I think it would be a lot faster. I think it's going to be a lot less work. But once again, nobody's strong-arming anyone. But I think that there's an awful lot of benefits here that are hard to get when you're doing it on your own.
All right. So let's go back here. Leslie, you had a question. This is going to be your administrator. So at this point, I'm not sure, it might be Sue, or May, I would think it would be Sue, is going to be issuing the ID and password. Depending on the type of access and how many people you will be working with, you may actually be able to have that, that ability. But at this point, I believe Sue's going to be giving access to people with their unique user ID and password. All right. Can we see the report to the CDC to confirm? Yes, you'll be able to see it once that information is being, once you're running it. We are working directly with the CDC to make sure all of that information is HIPAA compliant. And again, we are been working back and forth with them for quite a bit, a few months, and that should be up and going. We'd see it say within the next few weeks. Although the functionality is there, we still want to make sure that the CSVs are coming through in a proper way. But you will be able to see and know that it is de-identified. At this point, I don't believe you should have to get your any type of approval or okay. It is a software as a service, so it is all based on the web. So as soon as you have your access, all you have to do is go on. If you have access to the internet, you can get onto it. I'm going to go back here to your system. As you can see, it has the HTTPS. That is showing that it is a secure system. Everything on the system is encrypted and backed up. Again, you should be able to, once you have your access, just to go on and begin to work. It will not, there's not a need for it to talk directly to any of your other systems. So the web address for the New Mexico site, and I can send this to Sue, is going to be the nm.workshopwizard.org. So the report, Leslie, that I wrote on, I showed, the logos can be set up through our IT and programming for the ones that aren't able to be manipulated. For the Word one, all you would have to do is just cut and paste, put your logo in. These are great questions. Any other questions at this point? And everybody, I do have turned, your mute is off. And so if you turn your mute off of your phone, you can also talk to me. Not that I don't love chatting also. All right, Sue, do you have anything you would like to add?
The only thing I want to, actually, the only thing I want to add is that we will be fortunate in having hands-on training for about half of our refresher course in May with Joni. And so
yes, I'm very excited.
For people to hands-on practice and actually bring, if you want to start, practicing sending in, starting to set up your, folks that you have, that you're currently working with in some of your classes, that would really be
a great opportunity to hands-on practice because we've got reserved, there's a center in Albuquerque through the Department of Health that has, it's their IT center, and so we're actually going to have a computer set up for people to work on.
Sue, can you remind me of that date? This is Leslie.
Yeah, let me see if I was smart enough to put it in properly where it should be. Let me look real quick. Good question. Let's see. It's Friday, May 20th.
Thank you.
You bet.
Oh, she's got it on the screen there.
All right, and then Sue, would you like to comment on the new DPP curriculum?
Not today.
I can comment a little bit on what I know is that it has been based on some additional research that they've been doing that focuses a lot more on, again, more of the activity, more of the eating, and also allows for more unique delivery of different curriculums so that you can make it more specific to the needs of your class. My understanding thus far is that you do not have to use that curriculum. That is not going to affect your recognition level, but it is something that you have the option of using, and again has just been updated based on some additional research that has gone through. Now, with that being said, I am a master trainer, and I'm talking with DTAC right now to figure out if once someone is getting trained as a lifestyle coach, if that is a piece of the curriculum that should be included in the lifestyle coach training, or if it's just going to be one of those things that here's the general NDPP. If you would like to look at an additional curriculum, go onto the CDC website. So I'm getting clarification on that.
Yeah, and Joni, this is Sue. I'll add on that when I've been seeing the messages coming out to all those master trainers from Sarah, that they're actually going to sit down and review and go over this new curriculum so they can make some hopefully helpful recommendations, which include something like that in terms of the training to all of us. So more to come.
Wonderful. Wonderful. All right, any other questions? I will be posting this recording on YouTube. It will require a specific web address. I'll send that out to the same email list that I received to remind you about the training today. So you can go back and look at some of the questions and some of the functionality. Again, you will also be receiving, it's going to be shared with you, a user's guide. And again, you also have access to me, which is good. There will be 1 or 2 points of contact where that information can come through, but there's several different ways I can show you how to use the functionality, and that will allow me to help if there's a roadblock at any point or additional questions needed or needing answers. All right, any other questions at this point? All right, well, I definitely appreciate your time. I'm looking forward to meeting everybody and working through this. If you're anything like me, I really like to, it's one thing to see it, it's a whole other thing to do it. And so I think that's going to be very helpful when you actually kind of get your hands dirty and get all in the system and start really playing around with it. So thank you all for your time, and I look forward to seeing you soon.
Thanks, Joni. Yeah, because actually, one of the things that Mimi did before she resigned, before she left,